This isn't going to happen. Hey there, it's Dr. Jeff Pierce from Michigan Sports and Spine. We're in our 24th week. OMG. Next week's 25th. So we're going to switch it up a little bit. We want to get your feedback. So just a little teaser for next week. We're really going to talk about the COVID, the flu, the family members, what we can do. Because my big thing that I've been pushing over this 24 weeks is, it's not just wearing a mask, it's not the social distancing, it's what else can we do? I work on a prevention program a lot. What are you doing for prevention? What are we doing to build up our immune system? What are we doing to fight off anything that's going on? I've always talked about the proper sleep, proper nutrition, working healthy. We've talked about IV therapy. So that's going to be our big teaser for next week. So, we'd like to hear what you're doing, what your suggestions are, both from, the common person to the medical people. Let's share each other. Let's start sharing with each other our ideas. Because if you start listening to the media too much, it's not just about wearing a mask. It's not just about social distancing. Those are absolutes, but what else can we be doing? We need to be doing more. We're going into flu season. My prediction that maybe flu season might be a little bit less because we are doing all these precautions that we don't normally do. So I'm hoping that we're going to see even less illness overall. So nobody wants to say that. I don't think I'm the first one to say it. But our team here, we want to be proactive. We want to be preventative. Absolutely prevention with the mask wearing. We're totally endorsing that. But the other questions coming out is that we're wearing these little thinner masks, and even myself, I've caught myself doing it. How much protection are we getting from that mask? We all heard about the N95s, it's the best you can do, and then the micro milliliters of the particles are so much smaller that it's getting through these masks. What benefits should we be doing? Should we be using different masks for different situations? Us as a medical team, we definitely do that. So when we're going to higher risk areas, we make sure we're prepped a little bit more with protective gear. When we're going out socially, or we're going out to restaurants or the grocery store, do we need to wear that high level? You see people with scarves, you see people pulling their shirt up, with their hoodies. Is that going to be more preventative? What's really working? So that's, to just talk about next week, and we're starting to do this. We want to get more of your input for next week. We're going to talk about COVID. We're going to talk about the prevention. Coldness is setting in here in Michigan. Are the numbers going up? We're hearing statistically that they are going up. Is the strand weaker? Things like that. We're not going to be COVID heavy. We're still sports medicine and back pain, neck pain. But I think it's just something we need to address and push our philosophy on this COVID thing of what can you do to be extra preventative. And that's really the push. So remedies from you guys, any feedback from you guys would be greatly appreciated. So getting into the first question. Recently diagnosed with sacroiliitis. I'm wondering your thoughts on treatment methods for this. So big deal with sacroiliitis, for those who don't know it, the simplest thing, it's where the pelvis comes into the tailbone. It's the dimples in your back. So the dimples in your back are those two impressions that you have on either side of your tailbone. That's your sacroiliitis. That's where the sacrum and the iliac crest come together. That's the area where we get inflammation. So what do? A large percent of the time, it's not a primary diagnosis. So if you've heard me speak before, we talk about something called the primary pain generators and the secondary pain generators. And it's usually a secondary problem. Usually a sacroiliitis is secondary to what we call an L5-S1, more of an S1 nerve root. So you have to rule that out. You have to rule out that there's not a problem in the spine that's causing it, which a high percentage, over 90% of the time, that's the initial cause. So it's very rare, unless pregnancy, you fell on your tailbone, you did certain things where it's just that's the only diagnosis. So number one, sacroiliitis is usually a secondary diagnosis to a bigger problem. If it is primary, we do treat it. We treat it very aggressively. We treat it with mostly medication, sometimes patches to the area, aggressive physical therapy, aggressive home exercises, and if that doesn't work, we use injections. If it's a lot of pain, we're using steroid injections, but really we've seen great success with the PRP and stem cell injections, which is reducing the amount of steroids we're using in the area. There's a lot of surgeons out there that they have this new technique where they're fusing the area, they're stabilizing the area. That's a whole nother discussion that we can get into. But if you're flirting with possible surgery, then you probably need to be seen by someone like myself to see if there's alternatives. If they've proven that there's total instability in the area, then that's gonna be a further issue. So we need to really kind of get our hands on, but there is many treatment programs for it, many successful treatment programs short of surgery for that area. If it is a misdiagnosis, then you do need to worry about coming in and seeing someone, again, that have the proper tools for the diagnosis. So, question 2, how do I know if my neck pain is serious or not? So, serious or not. So we've talked about it multiple times. Obviously, neck pain is a common thing that we're treating here. You know, we call ourselves Michigan Sports and Spine. The neck is probably number 2 to the low back. Low back, we see more incidences. The mid back is probably number 3. So it goes low back, neck, mid back, usually in the type of injuries when we talk just purely spine. How do you know it's serious? I've talked about red flags. We've talked about numbness and tingling in the hand. Weakness in the hand is a bigger thing. Loss of reflex is a very big thing that becomes more serious. If it's like I'm just having neck pain and it's a little discomfort when I roll my neck side to side, that's not as big a deal. When we call that mechanical neck pain, as opposed to pinched nerves and neurological issues. You're making my neck hurt now. Anyhow, but you need to, we need to make sure that's a diagnosis. So if you're having numbness or tingling, that's something needs to be seen right away. If you're having loss of reflexes or weakness or atrophy, that's a huge indicator that something's seriously wrong, that you need to come in and get checked out. If it's just like, oh, I woke up stiff, I had the window open, and it just hurts to go this way, that's more mechanical back pain. It can be serious, like if it locks up or you spasm or your head starts getting pulled to one side of the affected side, that's another indicator that it's more involved. If it's just like, I feel a little sore, I can still do everything I want, I can look up, I can look down, all full range of motion, then, it's not as serious, and you can probably wait 2 weeks, take some over-the-counter anti-inflammatories, use heat or ice into the area, get a massage by someone who likes you, those kind of things. So, again, that's something we do a lot. If it's something that's lasting more than 2 weeks, you need to come in also. All right, so number 3, I love this question. What qualities should I seek when choosing a physical therapist? So when you come to Michigan Sports and Spine, I talk about my protocols. Do we have it written down and it's in this big private book and, all laminated and all that? Yeah, we used to, but we don't anymore. Basically what's going on is that everybody needs to be on the same page. So first of all, if you just pick on the therapist, you look at their training. If you're talking about injuries that we deal with here, like the sports injuries, the musculoskeletal injuries, the back, the spine, any extremity, we have to be very active. You have to be with a therapist that understands the mechanics of the body. This isn't like a stroke. It's not, multiple medical things where I just get exhausted walking from here to the bathroom. We're dealing with musculoskeletal sports, occupational injuries, whatever we're going to call it, mom getting hurt at home, those kind of things need to be addressed. So you want a therapist that's manually trained, that's very comfortable with their hands, very comfortable with the mechanics of the body, that they can treat and understand. The beauty of it is that I can tell within probably the first 10 minutes if the therapist knows what they're doing. They know how to assess the joint, the neck, the area. They know how to find the areas that reproduce the pain. You do not want to go to the therapist like, oh, you have back pain, we're going to put you on a hot pack, we're going to give you some ultrasound, we're going to give you some electrical stim, then we'll put you on the bike. That's not where you want to be. That's not helpful. Not saying that those modalities aren't helpful. You have to have the right combination. I call that cookbook therapy. In today's world of therapy and insurances, you're not getting unlimited therapy. I had one person, they can only go 2 weeks at a time and have to be recertified with their insurance. That's a ton of paperwork that's killing the actual time for the actual therapy, which I'm totally against. But who's going to fight with, you need to fight with your insurance company. It's really what it's coming down to. So when you pick a therapist, one, they should be manually trained if you have any injuries that pertain to this type of office. Manually trained, understanding, no cookbook therapy where it's, again, I'm going to put a hot pack, I'm going to use electrical stim. Those things are used, but they need to have like a hands-on, an evaluation. We'll look at what we call the muscle firing pattern. The way your neck moves, it moves in a certain way, especially your back. Your back moves in a certain way, and certain muscles should be kicking in. So when there's an injury, like the buttocks, the glute muscles, when you have a back injury to the lower segments, when we talk about that L5, S1 area, you're going to get quick atrophy of that area. Or if you have a higher up at 3-4, you get the thigh weakness. If you have hip issues, you'll get thigh weakness or knee issues. You have to be able to pick up on that and be able to complement that very quickly. Meaning it has to be part of the treatment protocols. If it's just like, go on the bike and you need to do some cardio, you need to do some weightlifting without any specific, every injury there's a specific way of rehabbing it. You can't just, there's not one thing that's good for everything. Running's not good for anything. Swimming might be, water walking can help with a lot of things, but there's not one therapy modality that helps with everything. You have to go to a skilled therapist. So one, again, to review, check their training. You want them to have manual treatment training, comfortable with these type of injuries. And, if you're at this office, it's usually we work with certain people with the protocols. Again, protocols meaning we're all on the same page. So you can have a physician that doesn't necessarily treat things the same way I do, but he wants to have a therapist where they're all on the same page. Like for instance, when you have a scope or a rotator cuff repair by an orthopedic surgeon or a knee repair by an orthopedic surgeon, you might want to go to his therapist where they're comfortable with what he wants, how long he wants it to sit and rest before you start passive range of motion, then moving to active range of motion. Those are all very important things for your recovery, and it's all about recovering as quickly as possible. For us, we've always been treating people, so they get to play by Sunday type of attitude. So, question 4. Do you have any exercises you recommend to people with COPD and emphysema? Should I do shorter workouts or longer but less intense? I'm trying to stay active and healthy, especially before flu season, but struggle with the shortness of breath. So this is a tough person. I don't know the age. We'll assume they're a little bit older in age. But anybody who's having breathing, I have young kids with asthma, exercise-induced difficulty breathing and stuff like that, where we have to build up their endurance. So it's really as simple as everything we're doing. We have to start somewhere. So the biggest thing, like your best part of this question is, should I do shorter workouts or longer but less intense? What shorter is, hopefully we're talking like 30 minutes. I'm hoping you consider shorter, and 60 minutes to be longer. The longer we can do it, the better, okay? High intervals where it blows you out is going to not do you very well. So you need to do it probably, if just to answer your simple part, longer, less intense is probably much more advantageous or better for you. So you want to be able to build up your endurance. Everything's about building your endurance with COPD and emphysema. You want your lungs to work longer. I've talked about it. There's little machines, little blow-up machines to actually do exercises for your lungs. Taking a deep breath, like when I talk about doing the yoga, and I make fun of it, but I'm actually serious, you need to learn how to breathe again. So when you're breathing, you need to expand your whole lungs. You take a very deep breath that opens up. If you do short breaths, you're only doing a small percentage of your lungs, and what happens if you don't use that part of it? It becomes very inefficient. I'm not going to say it dies off, but it's not working efficiently. So when you need a long inhalation, or you need to last longer, you need to, you're at a football game and you got to walk even further from the stands to the car, or you park further away because you couldn't find a close parking spot at Costco or something. You have to be able to build up that endurance. So what you want to do is build up the endurance. and breathing through it. The best thing you need to learn is how to properly breathe when you're exercising. So a lot of times people are like holding their breath, they don't realize it. If you have an instructor or these Pelotons or the Mirror, all these virtual things, they talk about breathing. And it's because it's so important. You're going to become more efficient. So if you're COPD and you're emphysema and you're already short breathing, meaning you're not taking those deep breaths, you're going to run into trouble. You can work longer, maybe a little bit slower, but you can keep raising that intensity each time. So to answer your question, yes, you need to exercise. The exercises that you do, the biggest thing is probably water walking or recumbent bikes for people to build up their cardio. Lifting weights or doing bands and stuff like that, that's absolutely helpful. You want to do that on a routine basis, but a lot of times it's building up endurance. It's walking. I see this one guy where I live, and he will never know I talk about him, but he's an old stroke victim that has the weakness, and he walks around. He's walking. I almost hit him. He was walking at 10 o'clock the other night, but I saw he smokes a cigar, so he's always smoking a cigar. So he's building the endurance, but hurting it with his cigar. But the point is that he's walking. I give him a lot of credit for the walking. So depending on what level you're at, just simple walking. And when I tell you to walk, it's not just go walk a mile, then you're stuck. It's walk a couple blocks one way and then come back home. You're safe. Walk the other way. The biggest problem is you get too far away. You get that anxious. You get a problem. You get the muscle spasms. That's not the best way to go. So everybody's like, oh, I have to walk a mile. Walk the short distances, come back, go the other way, or do it again, do it longer. That's the better way to look at it. So walking for sure for COPD. If you're better at it, we can do water walking, which will take pressure off the spine and the body and build up your endurance even more. Swimming helps. Recumbent bicycles, where you're actually sitting and pedaling is much better. If you're able to do that, if you have access to that, we really recommend that you get at least the simple pedals that you can put in front of your favorite chair, where you put your feet in and you're just pedaling at your favorite chair. That's very helpful. So building up your cardio, using the little blowing toys. If you've been in the hospital recently, it's the spirometer that allows you hold your breath, you blow the balls up. Those are techniques. Doing yoga classes, sitting in front of the mirror, taking a big deep breath is actually part of the therapy for COPD and emphysema, and the light weights is actually a big benefit. So you need to look at all those things. And to be honest, I highly recommend you come in and talk to myself, your pulmonologist. There's pulmonary rehab, there's cardiac rehab, there's very specific things to do and different phases. So if you're phase 4, we can't do so many things. If you're phase 1 and just starting out, you can do a lot. And it applies for my patients with asthma and things like that. But we try to be more aggressive. So the short answer is longer, less intense. Build the intensity on a weekly basis is probably the best bet. And then you can, when you get really good, you can do those short intervals to just stress yourself every once in a while to shock the system. You don't want to get into muscle memory where you don't challenge it enough. So hopefully that's good. But to be honest, I would like to, whoever you are, you probably should see someone like me or at least your pulmonary doctor. Some pulmonologists don't know about the pulmonary rehab, so make sure they're comfortable with that, and we'll be able to address it also. So question 5, I'm 66 years old, male, having muscle spasms in my mid-back. Will surgery be necessary now or in the future? If yes, then what kind of surgery? So you heard me start, I didn't even know this question was here, or didn't relay it, that we deal with, we're called Michigan Sports and Spine. I named it that way because I want it to be simple to understand what we do. We take care of sports injuries, spine injuries, and all your muscular injuries. The spine, number 1 area is your low back. Number 2 is your neck. Your mid-back is number 3. It's very, very rare, unless you have something crazy in your mid-back, to have surgery. The reason why is that your rib cage actually holds as a brace to stabilize the mid part of your back. So you have the most stabilization for your mid-back from that rib cage. So we're anatomically built that way. your neck, you're moving around, it's a free flowing, it's got more risk of injury. Same thing with your back. I had a patient yesterday from out of this, he was not from this country, and he's working out. He's got a very, very thin waist. He looks really good. He's got his beauty muscles going. He's got chest muscles, big arms, and big legs. What he's done is he's created a problem in his mid-back. We call that muscle imbalance. He's very weak in his midsection. It's the same thing with the back. It's more at risk because of it's already built as the weakest part of your body. So if you really go back to how we were made from the beginning, if we were walking on all fours and we came up, it's considered the weakest part of our body. You need to address that. Sorry, I'm not allowed to cough, so I want to make sure I was not coughing. But basically, your mid-back, to answer the question directly, and I'll get into this other stuff, it's very rare you need a surgery on that area. It's easy to rehab. A lot of chiropractors deal with the mid-back. They're able to mobilize it, get it back in. Hopefully they don't create hypermobility. Hopefully they correct the issue and move on. If you're worried about it, I would highly recommend you see myself or someone who's capable of evaluating the spine, eliminate any anxiety you might have about surgery, because it's, again, highly unlikely to have mid-back surgery. It's very rare unless, weird things like tumors and cysts and things like that. But as far as like what the majority of stuff is with herniated disc and bone, it is rare. So you need to, come in and get that taken care of. But again, getting back to the spine and the stabilization, the rib cage is considered a stabilizer, and the neck and the low back, we don't have that. You have that at a risk. So you're very concerned about that. So Nicole's waving me off for the last one. Was it 2 months? My right knee has started locking up when walking. Is this serious? So just to address it real quick, whoever's out there for that, yeah, we do not like locking up. Locking up means that part of the meniscus, the internal arrangement of the knee, something's not firing right. So it's either the bones are sliding out of place, or more commonly the meniscus, which is the cushion part of the knee, is either partially torn, it flips on itself if it's truly locking. Sometimes the kneecap comes out of place, which makes it feel funny. If you are older, the knee locks into joints. If it kind of comes out twisted, you kind of pull it apart and it falls back in. Those are kind of things that we can talk about. But overall, if it is locking, is it serious? I'm not going to say it is serious. It's something of concern that needs to be addressed. And you probably need to come in or see someone similar to my level in your area. And we're happy to do stuff. If you're not in our area, we're doing a lot of telemedicine, and we're able to take care of that also. So in summary, basically, we encourage you to be proactive rather than reactive with your health, especially with the immune system. Again, we want to hear from you what's going on with COVID. We're talking about immune system. We're talking about supporting your immune system is the new verbiage that we can use. We want to be able to do things to support your immune system. If it's getting you back on sleep-wake cycles, getting you nutritionally healthy, getting you, mentally healthy too. If you're very depressed or anxious, it drains your system. When your system's drained for whatever reason, your immune system is considered suppressed. Not like you have cancer suppressed, but it's still, there's different levels, and it puts you at a higher risk for catching any type of infection out there, not just COVID. So it's a healthier way of living. And there's certain foods that help. I love to get our nutritionist involved and hear from her what nutritional foods we can eat to be proactive in building our immune system, supporting our immune system. I'm sure my IV therapy companies that are out there would love to comment also. But there's all these other remedies. We want to hear from you what you think is the best remedy. And if it's the chicken noodle soup, which is part of my culture, is a great system for prevention and treatment. So, it's not just us anymore. Number 2 for summary, step it up. Again, we're not here to be cheerleaders, but we are pseudo cheerleaders. I'm here to educate you, have you understand what's wrong, have you understand what you need to do, and for you to execute it. And that's our goal. I'm not here to go home with you. I have one patient who's funny. She wants to take me home and, can we do this out of your car and things like that. And I appreciate that, but we're here to not build dependency. There's certain doctors that want you dependent on them. We don't want you dependent on us. We want you educated, tell your friends, tell everybody else, and send more people because we're doing the right thing for you. So again, take it to the next level. This is COVID. We've had a weird year. You need to, like you said, either you're going to find this as a barrier or an opportunity. So this is an opportunity to step it up, do things you haven't done. You've had time. God knows everybody's had extra time on their hands. I know the mothers and everybody that's been sitting at home and doing the schooling for their children are going to argue with me that I have less time, less free time because I'm homeschooling. And my heart goes out to everybody with that. My kids are actually old enough so I don't have to they're not dependent on me, but I have a lot of patience. There's a lot of stress dealing with that. There's stress for the teachers. It's a sad year from that aspect. But again, let's take this as an opportunity. Don't wait. If your pain and discomfort is continuing, you need to be seen. Again, the rule is 2 weeks. Like a few of these questions came in, what do we do? It's a 2-week rule. Don't let this escalate to another problem. If you feel like you're on the mend, things take longer than 2 weeks to heal. But if you're absolutely no better or worse within 2 weeks, you need to be seen. Be proactive. Don't let this thing linger and materialize into other things. And it's like if it's a hip injury, it's going to aggravate your neck. It's going to aggravate your back, your knee. All that stuff is going to feed off of it. So get in as soon as possible. Here, again, I push it every time. Dr. Khan's here now. We have another new doctor, Dr. Bonnet. We're available pretty much throughout most of Southeast Michigan now. So we're available to you. The biggest compliment you can give to us is to refer your friend. And and to like the Facebook thing that we're doing. We're actually on YouTube Live today for the first time. So that's really cool. So we're expanding our reach because there's a demand. And we love it, and I love doing it when there is a demand. So basically, we try to end with a quote of the day. You've heard me talk about the body is the best mechanism, the craziest mechanism there is. And I love this one. The best and most efficient pharmacy is within your own system. So understand that the healing properties, getting to PRP and stem cell, all that stuff, we call it the whole foods of medicine. It's all within you to heal. Don't drinking, smoke, all that other stuff is depleting your natural ability to heal. So be careful with that. Have a great weekend. We're going to start looking forward to Halloween. Send in your requests for COVID and your remedies for COVID.